Hi, everyone. This is podcasts for patients with the aplastic anemia and MDS International Foundation. I'm Leigh Clark, Director of Patient Services. Our podcast series is brought to you with special thanks to generous support from our patients, families, and caregivers, just like you and our corporate sponsors. Thank you to everyone for supporting this series. Today, we're going to be talking with Ron Duncan about Pure Red Cell Aphasia, or as some patients may know, PRCA. Hi, Ron.
Hi, Lee.
Thank you so much for joining us today. Tell us a little bit about yourself.
Well, I live in Dallas, but I grew up in California, and I worked for what is now known as Verizon. I worked there my entire career. So just before retirement, I got PRCA.
And how was life before your diagnosis?
Oh, it was fine. I was running and all kinds of exercise and living the good life.
Ron, what led to your diagnosis of PRCA?
Well, I went to give blood. I gave blood in December of 2004. And then again, they asked me in March of 2005 to give blood. And you go through a series of embarrassing questions, and then they prick your finger to see if you're okay. And the girl blurted out, "Mr. Duncan, what's wrong with you?" And I said, "What do you mean?" She said, "Well, your hemoglobin is only 7.8. I had no idea what that meant. And then she made me talk to the head doctor at the blood bank. And she said, "Well, if you were in the hospital, we'd be thinking about giving you a transfusion." So that was the first indication. So, of course, I went to the doctor, and a week or so later, I was in the hospital getting 3 units of blood.
Wow, all of that had to be very shocking for you.
Well, it was shocking, yeah. Well, they say the first stage is denial. I was still kind of in denial, I guess, or wondering what was going on. Then they did a bone marrow biopsy when I was in the hospital, and that came back bad sample. And so then they did another one in the office, and it came back bad sample. The third time they did it, they sent it to the UT Southwestern Medical School, and then they had 5 or 7 pathologists determine it was PRCA. I think the first people they had never seen it, so they didn't know what they were looking for. I think that's what happened.
And while you were waiting for the diagnosis, did they throw out other possibilities to you that could be causing the low blood count?
She mentioned MDS. She said, although I was a little young, but I think that's what they were looking for. And then why these things all came back as bad samples.
And then once you got your diagnosis, what happened next?
Well, my doctor was confused, I guess. She'd never seen a case, so she was consulting with a doctor at the UT Southwestern who turned out to be a guy who did transplants. So he was thinking of a transplant, I guess. But they tried IVIG treatments, and while I was there, it was in a place where they give treatment for chemotherapy. And I was thinking, all these people on the floor here, they can get a support group if they want, but they don't even know what I have hardly. So I made a vow that if I ever had a chance, I would try to get a support group for people like me. So the IVA treatments worked, but they only lasted like 3 weeks, and they take forever, and they cost a fortune. And so then they started giving me prednisone and cyclosporine, and I was able to eventually go a couple years without any transfusions. I guess no transfusions is their goal. And so that worked for a couple years, and I had some surgery, and that caused a setback. When I first got there was no internet, basically, and I'd go to the library, and the books had maybe had one sentence maybe about PRCA, and some of the books didn't have anything. And so eventually, though, the internet started working, and I went to clinicaltrials.gov. I'd never heard of that, and I found out that there were 17 clinical trials on PRCA, Most of them had not really revealed anything. But one of them was they wanted to study people with PRCA and other bone marrow failure diseases, or there were about a dozen. And they had 4 locations, UCLA, Cleveland Clinic, one in Philadelphia and one in Florida. And because I'm from LA, seemed like what they wanted to do was just to study us. Come every 6 months and we'll do a bone marrow biopsy and take blood, and we just want to follow you up. I think they were doing comparisons and they wanted to see how these things progressed or interrelated. And so I called to sign up, and I says, I want to go to, the lady's there was named Susan, and I called, she said, and I want to go to Los Angeles because I go to UCLA basketball tickets. I can go see UCLA play. And so she said, no, she said, told me I had to call Leigh Clark at the AAMDS. I had no idea what this was all about. But then Leigh, you recommended that you said, don't go to LA. You got to go see Dr. Majewski at Cleveland Clinic. And so you talked me into it, and I did. And then he looked at me, and then I came back 6 months later, and then he said, okay, we're going to try a new medicine. But by that time, my original doctor had left the practice, and I found a doctor. I had some connections at the UT Southwestern Medical group, and they connected me to another doctor. And between the two of them, they started giving me danazol. So I was taking prednisone, cyclosporine, and then they added danazol. And after 9 months, the danazol finally kicked in. The numbers kept getting higher. Their first goal is to not give you transfusions, but they're very happy when you get to 11 on hemoglobin. So whenever I would get to 11, they would start reducing some of their medications. I regret that I never kept a spreadsheet, so I can't tell the story exactly. But if I'd have known in advance, I would have kept a spreadsheet. And I kept getting better, and I'd get to 11, and they'd cut back another one of the medications, and pretty soon I was off of one of them, and then I was off of another one, and then pretty soon all that was left was the danazol, and I was eventually tapered off of that. So, and the rest is history.
Ron, now that you found things that are working for you and you're doing well, how do you still see Dr. Majewski as your PRC expert? And how does your team that you're with in Dallas, how do they coordinate your care?
Well, actually, I no longer take any medicine, and I saw Dr. Majewski I would go every 6 months, and I probably went for a couple of years, and then I would go to my local doctor similarly, and eventually I kind of phased them out of my life, so to speak.
Ron, you mentioned earlier in the podcast that you made a promise to yourself, and have you been able to fulfill that promise?
Well, yes, I started a Facebook group for PRCA, and so we had like 391 members, I believe. They're not all patients, some are parents. There's also a genetic version of this, and so some of those people actually have that. I try to get them to go to that. They have their own group, and I try to encourage them to go to their own group, but they stay around. They're from all over the world.
And Ron, for people who may be a little worried about, posting in Facebook and communicating, is this a private group where, only the people in the group are able to see and communicate?
It's a private group, and we also screen people. So they have to answer like 3 questions to get in, and if they don't answer the questions, I personally look at their websites or their Facebook page is available for me to scrounge around to see if they seem legitimate. And because personally, I like to get as many people in the group as I can.
It sounds like you guys go to great lengths to make sure the group is safe for patients and families.
Yeah, I have a couple of we have a couple of other administrators, so
Great.
we try to stay on top of it. We haven't been. It kind of comes in bunches. We'll get busy for a couple 3 days, and then it'll be lull for a week or so, and then we'll get some more action. So it's kind of because it's not very common, and like I said, we got them more from all over the world.
And Ron, if you could give, advice to other PRCA patients and families, what would be that advice?
Don't give up, I guess. Don't. There are a lot of options in treating this, and I don't think all the doctors know all the possibilities. And so the doctors themselves, they're not always willing or able to contact other doctors. And so in a way, you kind of have to learn as much as you can, and don't be afraid to get a second opinion or a third opinion, because doctors today don't have a lot of time. They are all, my experience with the hematologists have all been good, but I know just in general, the doctors are kind of rushed. And I've heard that from even the specialists. So
It sounds like seeing an expert in your disease is very important.
I think that's important for anybody with a rare disease. I think there are ways to research out as to who to go to. I guess that's not part of our conversation, but if somebody came to me, said they had a rare disease, I have a series of things I would tell them to do.
Well, thank you so much, Ron, for sharing your time and your journey with PRCA. And if you'd like to find out more information about PRCA and treatments, please visit our website, aamds.org. You can also receive information from us about PRCA through our Facebook, Instagram, and X accounts, or give us a call on our helpline, which is 800-747-2820. This concludes our podcast.